All right, welcome, Jeff McLaren. Jeff, you are CEO and founder of Medaxion. Medaxion is at the center of one of the biggest challenges in healthcare today, which is anesthesia, more specifically, the anesthesia service line, managing the anesthesia service line. Um, for those who don't know, give me the 1,000-foot view. What's happening right now in anesthesia?
Yeah. Well, I think there's a lot happening in anesthesia right now. But if you had to winnow it all down, is that what used to work in terms of how hospitals would staff anesthesia now costs a whole lot more than it used to cost. And and that then drives changes to the contribution of the OR to the hospital's bottom line. So that change in cost and that change in contribution is fraught. And there's many causes as to why those costs have escalated. But there's a initially, so to speak, there was a kind of a throwing up of hands, and hospitals were trying to figure out what do we do with this ramp in costs. I think healthcare organizations across the country, after this initial period of shock, are starting to bed into solutions.
Yeah. I mean, this is not a new problem, but it's just grown to the point where it's unmanageable, right?
Exactly, it's unaffordable. I mean, the challenges and the complexity in the OR environment have been around for decades. Hospitals have just managed it and dealt with it, not really solved them, but dealt with it.
hmm
But now that the cost of those issues is so high, they have to address it.
Yeah. Just, I don't know why I feel the need to, but just like to put the asterisk next to it. None of this is talking about the clinical quality of the anesthesia groups. It's
Exactly.
all just about the the the
The
rising
business of
costs.
anesthesia. It's the
The
business
business
of
of
anesthesia.
anesthesia is hard to manage right now. It's in short supply, and that doesn't seem to be getting any better. Like
No,
anesthesia, like there's not enough. I mean, we hear
that's
that
right.
across many specialties, but in anesthesia, it's at the center of everything you do.
That's right. And there's more demand now for anesthesia because more and more cases are being done outside the OR. And where those cases might have been done years ago with nurse sedation, they now require anesthesia teams to help with that. And so that's pulling on the anesthesia staff in ways that weren't 10 years ago.
Give me a couple of example of those cases that the anesthesia team's getting pulled for.
Well, it might be interventional radiology. It might be electrophysiology. An example of that would be putting in a pacemaker, right? Or
Mhm.
it could be different procedures that are done by interventionalists that, because of aging patient populations and patients are sicker, you need more expertise in the room.
Yeah. And I think that just goes back to the first thing you said is that we're asking for the same things, but that's not the way it's like those used to be OR cases, now they're procedure room cases. It used to be inpatient, now it's outpatient. So everything has really changed.
That's right. That's right. And it
Um,
could even be that the procedure cases that were done now require more expertise, right? So
mhm.
that's just pulling on the anesthesia team more than in past years.
You've been innovating since you started with your product, your first anesthesia EMR, helping people go from paper to digitizing their data so it can be more useful to them. Your latest innovation is you've developed a first of its kind tool platform to manage the anesthesia service line. So, one, I want to hear more about it, but two, why doesn't this exist?
I
Why
think
is this
you know
new?
it has not existed. That's right. There is no prior to this new product. There was no anesthesia management software suite. It was all managed through revenue cycle reporting and through Excel work. So it was a lot of hand tooling on how anesthesia was managed. In a nutshell, we developed this because of the pressures we spoke of a few minutes ago on the anesthesia service line and the fact that now more than ever, more sophisticated tools using data. Now that data is more and more accessible, using data in smart ways to manage the anesthesia service line. Two, because there's been a wave of hospital insourcing of anesthesia, those persons that were managing their practice as an independent entity, in some cases, those leaders are now employees of the hospital. And so the
Okay.
hospital now has to manage that service line rather than others. And so there is a shortage of expertise in anesthesia. So the ability that information tools can help with the people that are newer to managing anesthesia is only going to benefit the industry.
So the cost of anesthesia is going up. The supply of anesthesiologists is going down. The demand for anesthesia is going up. Um, the number of people who know
Well,
how to manage
and
anesthesia
Scott, I
is
would
going
say,
down.
I would say it's not so much the supply of professionals that can provide anesthesia is going down. It's just not going up fast enough to meet the
Okay.
accelerating demand, right? So, and there's been some challenges with the supply of anesthesia providers in that for example, the program for CRNAs went from a 2 to a 3 year program. So in that period of transition, the United States lost an entire year of graduating class of CRNAs because they had to go to school for an extra year. Now that all evens out over time, but in that transition window, you lost a graduating class. That's
Yeah.
just going to constrain supply of anesthesia providers.
So what's some of the good news? Like, because there's a lot stacked against the efficient operations of anesthesia right now. But what's some of the good news that you found in bringing anesthesia manager to market and helping people with their utilization of their providers? Like, what are you seeing that you're able to impact with just better management, with the data to do better management? Everybody's been trying to manage well, but now you have the data to
Yeah.
direct them.
Yeah. And I think the first hurdle is bridging the disconnect between hospital C-suite, particularly the CFO office in a hospital, who's being asked to write or to underwrite a much larger portion of the anesthesia service line, oftentimes called a subsidy. The
Mhm.
connection between that party and the anesthesia service line. So there's a hunger and a greater demand to understand why are those costs increasing? What can I do to help mitigate those costs? And it's not doing things as they did before and expecting a different result. You have to do things differently now.
Right. Um, so when you're demonstrating anesthesia manager to that CFO and you're showing them ways to see anesthesia, visualize anesthesia and how it's operating, like what's the reaction they're getting? Like this is data that they haven't been able to leverage before.
Yeah, I would say, it starts, the way we approach it is, first of all, making sure they understand the volume, the surgical volume in their system and the requests that they're making from the anesthesia team. And then for coverage for that surgical volume. And then what is that cost of that anesthesia coverage? What is the shortfall in terms of the revenue that the anesthesia team can generate versus the cost of the anesthesia team? And that delta is going to be a subsidy that the hospital is going to have to make up. And then
Mhm.
importantly, in walking that individual through, what can I do about it? Now I understand the economics of anesthesia. What can I do to help bend that cost curve? And um, that's the part that is the most rewarding for me when we make these pitches is those individuals then jumping and saying, okay, I'd like to understand better operationally, how does that manifest to my teams?
Mhm.
So, okay, now I understand what could be done. How do we do it? And we provide that tooling to help not only the CFO in the hospital understand progress, but to help operational teams that are responsible for staffing anesthesia.
Yeah. You've often said to me that anesthesia is where the data is. Like, unpack that a little bit. Why is
Yeah,
there more data?
anesthesia is a mystery to most people, right? If you have surgery or if a loved one has surgery, you might meet the anesthesia provider right before surgery, but you wouldn't have met that person before. Okay. you might have a relationship and a visit at the surgeon's office prior to the surgery, but you're meeting the anesthesia professional typically right before surgery. And then they whisk you into the OR and then you're asleep. And you don't really understand what's happening during anesthesia. And it actually, in some cases, some of the folks in the OR that are nurses and surgeons may not fully understand what's happening in anesthesia either. The anesthesia team is responsible for managing your complete physiology. A typical anesthetic, they're giving probably 10 different drugs to you during the course of the anesthesia to make you unconscious, to control your physiology to benefit the surgical procedure. So they're having to draw up those drugs, track those drugs as they're administered. They're having to document your physiologic response to the drugs and to surgery. They're having to document procedures they do. And so the traditional paper record of what they would have done, fills an entire page. It looks, part of it is a graph, looks almost like is gridded out like graph paper. And there's tick boxes and forms to fill out. Now, in many cases, that's done electronically, but there's just a ton of data. So when we say that's where the data is, it's because there's so many disciplines and aspects that are documented by the anesthesia team, including time-based events. So when did surgery start? When was her timeouts? Now, some of those events are also tracked by nursing, but the anesthesia team is tracking a number of additional events that are relevant and interesting in terms of trying to manage anesthesia staffing, but also in terms of thinking through the care of the patient.
When you're talking about anesthesia manager and this technology that's not only data, but it's also like really making recommendations on optimization, but like you're pulling in 15 years of data, like 900 locations, 7,000 ORs. Like why is that database so important?
Yeah, it allows us to benchmark in terms of true peers. It's one thing to think about, two hospitals, that might be in the same area within a city, but they might be quite different. They might do different kinds of cases. You know, they might have different areas of specialization. They might have different volume levels, and so all of those things are just going to drive different operating parameters. And so having that large database of cases and then the profile of facility that case was done help us drive benchmarking that are to a facility that is comparing themselves to a true peer.
And it sounds like you guys are a real bright spot in what's a really challenging issue for everyone involved in anesthesiology. How'd you get into it? Like you've started multiple health tech businesses, mostly focused on anesthesia. What drove you to that? I don't
Yeah,
think I've ever asked you that before.
no, it's interesting. It's over 20 years ago. An individual that I was on a corporate board with had retired to New Zealand of all places, and he ran across an anesthesia information platform that was developed down there, and was looking for larger markets. New Zealand, a relatively small country, under 5 million people. United States, a pretty big country, pretty dynamic market. And so that was my first entree into anesthesia. As you said, I've been in healthcare IT my entire career, having started a business right out of college, as much as anything because I didn't know any better, right? But no, but I'm really proud of that, and I'm still affiliated with that company too.
I wish I was still as
But I
smart as
kind
I
of
was
fell
when I
into
graduated.
anesthesia. I fell into anesthesia, and I love it. It's a incredibly unique and in many cases just misunderstood or a specialty with not a lot of understanding by the general population. So a
Yeah,
lot of opportunity there.
excellent. Okay, quick quiz for you. The Root Three Pointers quiz at the end. You don't
Okay,
get off easy. So
good.
you're based in Nashville, and so
Yep.
it's the Grand Ole Opry's 100th anniversary. So I pulled up some quiz questions for you. I have no idea if you have
Uh-oh.
any idea
Okay.
about anything at the Grand Ole Opry, but here we go. Um, did the Grand Ole Opry like Elvis's first appearance?
I would say no.
The reaction. This is what he performed Blue Moon of Kentucky, and the Opry famously told him to go back to driving a truck. Um, Another one that
I'm
they
not
missed on,
surprised. I'm not surprised. Yeah.
they refused membership to Hank Williams as well. So they got it right a lot of times, but those two.
But they got it
are kind of
wrong
fun.
sometimes too, clearly.
Yeah. Okay. Was it originally called Grand Ole Opry?
No.
No, it was originally the WSM Barn Dance. And the commentator started, he said, for the past hour, we've been listening to music largely from Grand Opera, but from now on, we will present the Grand Ole Opry. And that just caught on, and everybody
Now
called it the
that
Grand
I
Ole.
didn't know. I did not know that
That
how
was kind of
that.
fun. It was 2 years
That's
after it
great.
launched in 1927. Was the Grand Ole Opry credited with the birth of bluegrass?
It's the birth of bluegrass.
Yep,
I might say yes.
it is. It's credited for the birth of bluegrass. So this is my setup to the last question here. You get to choose the oddest ever performance at the Grand Ole Opry. So
Huh.
performance artist who communicates only through sneezing, a silent monk who specializes in 90-minute silent sets, or an AI hologram that only performs in binary code. They're all real. You just have to decide which is the weirdest one.
First.
All right. The sneezing. On that, thank you for appearing on the Ruth 3-Pointer podcast, Jeff. It was nice talking to you, learning more about your products and your career.
Hey, thank you, Scott.
And I think you nailed the quiz. I think you got them all right.
I was
so
batting
congratulations.
1,000. I was batting 1,000 on that. Yeah.
Well done.
Yeah.
Well done.
Thank you, Scott.